Hi, my name's Dean Toriumi. I wanted to chat a little bit about preservation rhinoplasty and how it's really impacted my practice. In June of 2019, I embarked on a new stage in my career where I actually incorporated preservation rhinoplasty, particularly dorsal preservation, into my practice. Now, those of you who know me know I'm a structuralist. I'm a structures rhinoplasty surgeon. I started in 1989. I've been doing grafting all my entire career. But I had an idea that this technique, dorsal preservation, had a lot of possible upside that could be incorporated into my practice. I was having some issues with component hump reduction. That's when we take the hump off the top of the bridge and then we reconstruct the middle vault. But when you look at these patients over years, you start to see some changes in the mid vault. The upper lats move in, you can see edges of nasal bones. These are all things that detract from your frontal view result. And it was really frustrating to me in a lot of different ways because I would spend more time reconstructing the mid vault, and no matter what I did in thin-skinned patients, things tended to happen over time. Now, when I started doing preservation rhinoplasty, or specifically dorsal preservation, what we're doing now is we're not disturbing the roof of the dorsum. Maybe a little bit of bony cap reduction, but nothing major. We're not opening the mid-vault. And what we're doing is making cuts along the side of the bony vault. And then we're taking out strips of cartilage and or bone underneath the dorsal hump and literally pulling the hump down towards the face and fixing it into position. It's an incredible concept. It's been around since the 1950s, but back then it was a different operation. Now it's a much better operation. It's been improved by many very talented surgeons around the world, and it's gotten to the point where you have 5, 6, 7 different techniques. All of them are very good. All of them can be used in multiple different scenarios, and the outcomes are so much better. Now, what I can do is I leave the skin attached to the bridge. I go underneath, I take the strips of bone out laterally, take a little cartilage underneath from the top of the septum, middle of the septum, or the bottom of the septum, and literally push the hump down, and then it gets fixed into that position. So when the cast comes off, the skin on the bridge hasn't even been touched. It's as if nothing's been elevated, no trauma to that area. All the trauma is deeper underneath the hump. So when the cast comes off, the nose looks as if you didn't do anything. And so this is a huge departure from how I used to manage the dorsal hump in the past. And now, because of these changes, we're able to create, in my opinion, a better outcome, because I'm seeing it in my patients now after doing it for 5 years. It's just an incredible change. It's a huge advancement, and I think patients benefit. I think it's much better for the surgeon as well because it gives them more flexibility. It allows them to preserve structures that are favorable in contour, nice dorsal aesthetic lines. We can preserve those. We don't have to take them down and then reconstruct them. New concepts, better operation, better for the patient.